So initially, just like to thank everybody for joining and appreciate you taking the time out to come on this call. So just important to just mention our colleagues AdEPT and why they're on the call. We are, as some of you will know, an N3 aggregator, and as such, we looked at the market long and hard for who to partner with for provision of HSCN. So when we decided to become a HSCN provider, we wanted a supplier that kind of fitted well with our business and our model and our offering, and AdEPT fit that bill. So we've invited them to join us on this webinar today, and they'll be joining a little bit later. Okay, so I just want to run through the agenda for this call. I guess it will be somewhere between 30 and 45 minutes in total. Most of you, if not all of you, will be muted. But what I'd like to say is please ask any questions on the chat facility, and what we'll do is collate those. And then at the end of this session, we'll answer those at the wrap up, if that's okay. So just to briefly touch on the agenda, we'll do some introductions. So who is on this call today, who's going to be talking to you. A little bit about AIMES and a little bit about AdEPT, for those that don't know us, a bit of background. We're going to talk about HSCN, obviously, with an overview, but we'll also talk about the transition network as well. We're going to talk about timeframes, we're going to talk about the financial benefits, and also some of the funding around HSCN, which is quite key to this. And then finally, we'll move into the technical and governance ramifications of HSCN as against N3, and also our approach to HSCN as AIMES and what that means for our customers and what that will mean for you on this call. And then at the end, we'll answer those questions and have a bit of a wrap up with any other business that might come out of this session. Okay, so on to introductions. So I'm Ed Critchley, and I'm the Chief Commercial Officer here at AIMES in Liverpool. I'm joined with Richard Spragg, who's the Technical Director here at AIMES. And then our colleagues at AdEPT, we've got Tim Scott, who's the Group Head of Commercial, and Gary Drinkwater, who's the Head of Business Development. Okay, so about AIMES. For those of you that don't know AIMES, we're based in the northwest of England, here in Liverpool. We're known probably by most people as a cloud service provider and a data centre. A little bit on our background, we were formed back in 2005, originally as a non-for-profit organisation spun out of the University of Liverpool. And I guess if you look back at our history, we started as a grid computing company and moved into co-location and hosting. And I've kind of made that journey to cloud, and that's very much where we see the market going and everything going in reality. So our customers typically now are made up of predominantly the public sector, and within that, the healthcare sector. But we do have both private and public sector clients. But if I look at our service offering and where we're going as an organisation, predominantly we are focused on both the NHS and the healthcare and associated industry and marketplace. So for us, HSCN was a logical, as I mentioned earlier, progression for us as an N3 aggregator, and we want to be kind of at the forefront and helping our customers make that transition. So hence the webinar today, I guess. So I'm just going to hand over to Tim at AdEPT, and for those that don't know AdEPT, he will give a little bit of background on AdEPT. So over to you.
Thank you, Ed. Thank you. So AdEPT Telecom, by way of introduction, we were founded in something like 2003. Traditionally grew out of being a voice provider, both to commercial customers and public sectors, and grew into really what was a combined voice and data network provider. And in fact, today we would describe ourselves as a IT, UC, voice and connectivity provider to both commercial and public sector clients. Indeed, on the slide it says our customer base is split, so 1/3 public, 2/3 commercial. We are an HSCN compliant supplier. In fact, we're on a number of Crown Commercial Service frameworks as well. And if I think about our customer base, on the commercial, if I were to mention Coca-Cola and talk radio, that gives a good example of some of the commercial type of customers that we deal with. But particularly in public sector, we actually have 109 councils spread around the UK as customers. We provide services to over 4,000 schools. We've got 9 NHS trusts. We provide voice and data services to a number of social and healthcare entities, particularly hospices and health residential homes. We also provide what is 70% of private hospitals in London utilise our voice services. So as a quick background, hopefully demonstrate that we've got a fairly substantial pedigree in public sector. And if I'd like to move from this and hand over to the meat of the presentation to Richard at AIMES. Thank you.
Thanks, Tim. Good afternoon, everyone. So just to explain for those that don't know, I'm guessing everyone's heard of HSCN and hence joined the WebEx this afternoon. But HSCN is obviously the replacement for the N3 network. N3 has been in existence for a number of years now. Single vendor solution managed by BT with the aim of connecting up NHS organisations and also organisations that are providing services to the NHS. HSCN has been a couple of years in the making and is a completely different model where we've gone, NHS Digital have gone for a multi-vendor approach. So they've asked comms providers to go through a rigorous compliance process for them to basically create a marketplace for providing connectivity across the NHS kind of landscape. But to give end users a choice really around which supplier they go for, and you know, a number of reasons for doing that. But one of the main things is obviously to reduce costs, and we're going to come on to some of the funding arrangements later in the presentation. Just to go on to the actual architecture of the HSCN network. Got a small diagram here that we've lifted from an NHS Digital presentation. Essentially, the HSCN network comprises of 2 peering exchanges, one in London and one in Manchester. All of the HSCN suppliers, once they've passed the correct compliance process, will physically connect into both peering exchanges, and therefore HSCN traffic can flow from one NHS organisation to another, regardless of who the suppliers are. You can see the access connectivity at the end of the service provider networks there, shown in the blue bubbles. What you'll also see is that the transition network there in the green bubble is what we currently know as the legacy N3 network, which we're all currently connected to. And that will also be plugged in, or is also already plugged into the peering exchanges. And hence there's a seamless connectivity across from new HSCN connections from the new suppliers through the peering exchanges across the N3 network to legacy connections at the other end. Obviously, there's a move to migrate people from N3 to HSCN, but the way that the network's been set up, the routing and IP addressing and everything else should be the same. And should be accessible from all points across that. So just to run through some of that migration process, the first HSCN services started to go live around October time. NHS Digital looking to switch off the N3 network, as it were, probably around 2020, basically looking at people's contracts running down, their current N3 connectivity contracts. Obviously, there's as you can see from the slide, there's about 13,000 legacy connections. So there's a fair number of migrations to be done, and there's a big push now to get organisations to migrate to HSCN. This has to obviously be done in liaising with your supplier, but also with NHS Digital and BT as well. And the process has been put in place to be able to do those migrations. Our advice as well would be to start planning for this now, start thinking about it, and start talking to the relevant parties to get that underway, because as it ramps up, the lead time for booking in migrations from one to the other are going to get longer and longer. So I'll just hand back over to Tim now to talk a bit around the financial benefits and how the funding and procurement might work for you.
Thank you, Richard. Thank you, Richard. Thank you. And once again, good afternoon, everybody. So within the NHS facing an estimated funding gap of 30 billion by 2020, there's an enormous pressure on the health service to increase operational efficiency and cut costs. And this provides an important context. The urgency to move users from N3 to HSCN is primarily driven by the cost savings that can be achieved even by simple lift and shift of existing services, and that is existing N3 services onto new HSCN connections. Indeed, NHS Digital and Crown Commercial Service both have used figures from in the order of 30% to 50% savings that could be achieved by making this change, albeit, in truth, the savings that will be different for every organisation and dependent on when they join HSCN. So in terms of funding, used to pay for N3 connectivity has already been decentralised. To support the transition from N3, NHS England secured funds to pay for legacy N3 connections and future HSCN connectivity, but also importantly, the costs associated with setting up new services, which provides an element of time urgency on the NHS organisations in particular to move off N3 whilst that migration funding is being made available. So the clock is ticking, and April 2020, as Richard said, is the date that NHS Digital and NHS England want clients off of N3, and obviously it is the sooner the better. So if you're one of the participants on the call that is within NHS rather, you will know that in July, NHS England sent confirmation of HSCN funding to every listed NHS organisation for 2017 and 18 and beyond. This clarified the connectivity funding for NHS trusts and foundation trusts. It also provided clarification on connectivity funding for CCGs and GPs, albeit the CCGs hold the funding for the general practitioners. It also confirmed that the funding levels for 2017 and 18 were based on the cost of N3 connectivity during 16 and 17. But several conversations we've been having with some authorities, we're already seeing that expected budget cuts to be up to 40% from next year. And that is really driving the aim to get organisations off N3 as soon as possible. So for many, there is obviously a decision because actually reduced cost savings and funding for migration also creates a decision of do we go for technology change and particularly technology uplift. And by way of example, over the last 5 or 6 years, the cost of Ethernet connectivity has fallen by more than 50%. It's now more economic to buy a 100 meg Ethernet lease line than it is to buy a 10 megabit. So it demonstrates that not only has costs come down, but obviously technology adoption becomes more prevalent. So in terms of getting access to HSCN, if you're in the public sector, you'll obviously know there are 2 Crown Commercial Service frameworks now live. There's also the third option of going through a standard ODU route, but both RM1045, which is the Network Services framework and is still will be valid until 2019. Lot 1 provides organisations, public sector organisations, with the opportunity to buy HSCN services. As of last week, 3825, which is specifically dedicated to HSCN, became live. And if I'm correct in saying there's something in the order of about 9 HSCN suppliers now on that framework. But 3825 is very much a a dynamic purchase system. So therefore, legally, you're unable to provide a direct award on 3825. So if you're not joining a large aggregated procurement or a collaborative procurement, and you've got relatively simple buying requirements, RM1045 is definitely still the most efficient way to go ahead. But if you're a commercial organisation, obviously normal rules apply. You can procure direct, but actually if it's standardised terms and conditions, particularly around HSCN compliance and commitments, then actually 3825 is also available for you to use as well. So there are many benefits around terms and conditions, and it does, and obviously that framework does give you access to compliant suppliers. So if I'd like to move to the next slide. So there are technical governance ramifications, but what I would say is that, well, firstly, if you're new to HSCN, you do need to register with NHS Digital, and we'll provide the website details at the end of the presentation. For that, you'll do need to know your ODS code, your organisation name and address, and the code that's allocated to you. That can also be found via the NHS Digital portal if you don't have that. You need to provide that and a name and email of an HSCN point of contact within your organisation to register with NHS Digital. But whether you're new or existing, you do need a connection agreement. In fact, as a supplier, we're being asked to, when we take orders, not only to know that the buyer has a connection agreement, but also we need to have their ODS code as well for reporting purposes. But significantly, connection agreement does replace the existing N3 Information Governance Statement of Compliance, the IGSOC. However, if you still want access to national applications, such as the NHS e-referral service, or even PDS, the Personal Democratic Service, you are still being asked to comply to the Information Governance Toolkit in kind. So whilst the Information Governance Toolkit is not necessarily a live requirement, you need to be able to prove that you can comply with the standards associated with that on an annual submission. So importantly, that's for the buyers. For the suppliers, I think there's a lot of comfort in HSCN because, as Richard said, we've now got a competitive marketplace. There are now a number of suppliers, and there is an obligations framework of something in the order of 140 obligations that every supplier who is compliant has to adhere to, and they cover a range of different things from technical definition, security compliance, business continuity, and service management in particular. But there are a set of standardized processes. So as you get through stage 1 and then stage 2, and the only difference between stage 1 and stage 2 is a level of granular detail. And as a supplier, as stage 1, we can go to market and effectively sell and contract. But in order to deliver an HSN circuit, the organisation does need to be stage 2 compliant. But from a public and a commercial perspective, as a buyer of HSCN services, there's a lot of confidence in the obligations framework that all suppliers are adhering to a standard set of principles, obligations, and technical standards as well. So on that note, I'd like to hand back to Richard, and thank you.
Thanks, Tim. And I think just to add to that, obviously working with AdEPT ourselves in terms of our connectivity, for a full list of suppliers and where they are with the compliance process, you can check the NHS Digital website, which we'll give at the end. So just to explain a bit about what AIMES is doing with regard our existing customers, for those that are on the WebEx. We ordered our HSCN connectivity. That's looking to be installed in the next couple of weeks. We'll be doing some thorough testing on that connectivity to make sure that we can see known endpoints that some of our clients use, to make sure that users on the N3 network that are accessing the things that are being hosted here at AIMES still visible across HSCN. Once we've finished that testing, we'll be looking to migrate completely across. There won't be any IP address changes for any of our clients, keeping all the IP addressing the same, and we're looking to do that in the new year. So we'll notify people in due course when that's about to happen, but should be fairly seamless. We're working together with AdEPT and NHS Digital, and also with BT in terms of their management of the N3 network to make sure that runs as smoothly as possible. In terms of the commercial arrangements for customers, because of the cost savings around HSCN, we'll be automatically giving all of our customers a 10 times multiplier on their bandwidth allocation as soon as that service goes live, and we'll notify you as part of the migration process to explain about that as well. I think that's about it in terms of what we're doing with our hosted customers. If you've got any questions, as Ed said at the start, if you could just write those into the chat and we'll pick up on those now. I'll hand back over to Ed now.
Okay, thanks, Richard. So either that was the most comprehensive webinar ever, and there's no questions, or the chat facility is not working properly, but please do send through anything that you can. So I guess that's sort of coming to the end of the webinar. The message, hopefully, that you take away from this is there's a big advantage to moving quickly to HSCN. And it's not just a cost advantage, but it enables so much more. And I think for lots of our customers and people out there, it's an opportunity to make that move to the cloud. So hopefully that has come through. But as you'll see with the more information, just come talk to us about it. We'd be delighted to come and see you and discuss this further, both ourselves and our partners at AdEPT all together. So the emails and phone numbers are up there. More information's on the NHS Digital website, and I'll just do a last check for questions. No questions. So yeah, I'd like to thank you all for taking the time this afternoon to listen to us. Please get in touch. We'll try and do this on a more regular basis and keep you guys informed. But enjoy the rest of your afternoon. Thank you.